back to the Natural Touch YouTube channel. I'm Hasnain Abbas, Alternative Practitioner in Bradford, West Yorkshire. The reason for this video is that when I've been approached by cancer treating family and the patients, there seems to be a misunderstanding. There is a problem, and the problem is that the society as a whole has been so conditioned into thinking that there is nothing other than orthodox medicine treatment, that they can't think past certain level of understanding, and they really don't believe that alternative treatment doesn't work. They really think it's a waste of time, and they think this is nonsense. And there are people actually called alternative treatment practitioners, various names, and they don't know what they're talking about. This is the reason I want to make this video and make it quite clear what is good and what is bad in treatment of cancer. The reason the alternative treatment fails, there are 5 reasons for alternative treatment fails in cancer. Not because the treatment is inadequate, rather the contrary. These are the 5 reasons. Alternative treatment is a very practical program in treating patients with fatal diseases without any side effects. It is purely plant, herbal method of treatment, non-corrosive, non-medicinal. We're not allowed to make medicine, we don't give medicine, we don't prescribe medicine. Our treatment is purely plant-based. The 5 reasons are, let me just tell you. 1, not picking up the right plant to begin with. 2, waiting until it is too late to begin using alternative treatment. 3, failure to stick with one treatment program. 4, following treatment plan completely, or rather not following the treatment plan completely and properly. And 5, discontinuing treatment. From the listed 5, let's examine each of these 5 common reasons alternative treatment might fail for you. Also, we will explore using the alternative cancer treatment and to help ensure that alternative treatment do not fail. This is so important in this video. Reason 1. First off, let me reiterate that trying one or few alternative items is not using an alternative plan to try to defeat cancer. For the most part, there is little more than haphazardly thrown few supplemental items at the cancer in the hope that they might somehow work. It saddens me to no end to see the mainstream proponents almost gleefully proclaim how alternative cancer treatment failed when someone tries such an approach. In such instances, there was really no failure on the part of alternative cancer treatment. Rather, there was a failure to ever adopt a true alternative plan to begin with. A second problem which occurs far too frequently is when people with cancer fail for what I call one-trick ponies. That's right, adopt a product or a plan based upon hype and or cancer discussion broad legends. Some example includes such examples as using lateral by cell. For a time, lateral was a very popular method of cancer treatment, thanks to it in large part to 2 reasons. One was the publication of the book by G. Edward Griffith, a book called World Without Cancer, which touted lateral as pretty much the solution to cancer. Another reason was much publicized firing of Dr. Ralph Moss from his position as publicist from Solon Memorial Catering Hospital. as shared in the June 2017 issue of the Heroes Against Cancer newsletters, Moss was fired as he outed in the hospital for covering up results of lateral studies conducted by one of their own doctors. Although lateral is very beneficial for preventing cancer as part of an overall anti-cancer protocol, it should not be used as a stand-alone treatment for cancer. When people who use lateral also use other supplements, such as the alternate treatment, as well as items that adopt healthier diets and lifestyle changes, we saw remarkable results. The second reason alternative treatment fails, which is contrary to what it is, waiting until it's too late to begin alternative treatment. That's right. Most people do not turn to alternative cancer treatment until they've been told by their oncologist that there's nothing more that mainstream medicine can do for them. Compounding this problem is that doctors frequently hang on to their patients long after it has become apparent that conventional treatments are failing. Terminal cancer patients are often given harsh chemotherapy drugs and radiation treatment long after their oncologists have determined that curing the cancer is hopeless. In many instances, such treatments continues up until the moment of death or until that insurance policy runs out and the family savings are exhausted. As a direct result, many cancer patients are cruelly subjected to needless expenses and suffering, while little time and resources are left for alternative treatment that might otherwise have extended their lives. A study published in the journal Cancer 2010 found that radiation treatments were given to 91% of dying cancer patients. Half of the patients spent more than 60% of the remaining lives undergoing radiation treatment. Most died before they were able to complete their treatment. The study also found that instead of reducing pain, the treatment most often actually increased their pain. Thus, cancer patients often have scant weeks or even days to live when they turn to alternative treatment. Amazingly, sometimes the best alternative treatments are successful. Beside the short time the patient has left to live, their immune systems and major organs have been badly damaged by their harsh allopathic treatment. Plus, since mainstream cancer treatment usually only destroys the least resistant cancer cells, the remaining cancer is made up of cells which are most resistant to any treatment, alternative treatment or mainstream. Number 3 reason is failure to stick with one treatment program. That's right. This is why we have developed a treatment program per person, per patient. Cancer often causes a lot of stress and anxiety, which is understandable since the patient's very life is usually at stake. Sometimes this leads to cancer patients having little patience with treatment when they try. It is not unusual to see that happen from one treatment supplement to another, never giving anything enough time to be effective. Alternative treatment often takes time to be successful. Bear that in mind. Certainly, no one should expect to stick with treatment modality which is not working, but it should be given enough time to make sure that it isn't. Of course, the earlier the person opts for alternative treatment, the more time they'll have to try and approach and then switch if need be. The problem I found with my own patients is that due to conventional type of treatment, they don't understand what this illness is, quite literally. Let me just explain to you what the cancer is. Let me just tell you what cancer is, okay? You've got to bear this in mind when you approach my clinic. Think of cancer as an invading army of cancer cells, which has gained foothold in your territory, the body. Once you begin to employ your anti-cancer resources, it will take time to first slow down the advancing army, fight it to standstill, and then begin to gain the upper hand and defeat it. Take an extract from late Dr. Mark Swanpoel. He shared this timeline regarding his own highly successful anti-cancer protocol. The normal situation is as follows. The rate of growth of tumors slows down after 3 to 6 weeks. The cancer stabilizes after 6 to 10 weeks. The tumor starts to reduce in size after 10 to 16 weeks, and patients in remission from 8 to 12 months. Therefore, my own treatment program starts from 36 to 60 months because it's very recent I've given you. Here, it must be noted that sometimes there's only a slow decrease in size due to the fact that the bulk of the cells inside the tumor may be normal cells. So even if all the tumor cells die, then the remainder of the normal cells will retain their size. The tumors may become hard and encrusted and may take a long time, even years, to be reabsorbed by the body. Number 4 reason is not following treatment plan completely. That's right. I've seen this happen to many of my patients. Oh, it's not working, I'm going. That's what happened. The very best alternative treatment are comprehensive ones, the one I devise for my patients. In general, their components are not optional where you can pick and choose only the ones you want to follow. I've heard that in my own patients. We'll take this, we won't take that. The different components are all there for reasons, and you're changing yourself if you don't follow all of them. And I've heard that with my patients saying, oh, this is too many, and can we just take this, that? And this is the very reason I made this video, for those people to look at and understand where I'm coming from. Make sure you're following all the components of your alternative treatment plan and not leaving out important steps. Take supplements, for example. Note the word supplement. They're not called medicine for more than just one reason. The FDA would frown greatly on such practice. They are supplemental items which you must work with in order to achieve success, not simple items you can throw at a cancer or any other condition. That's how mainstream drugs are frequently used, and it is worth noting that those drugs cure almost nothing. Instead, merely they manage the symptoms. 5th reason why people fail is discontinuing a treatment before it has completely successful. One of the most disheartening things I have experienced in my years of helping people with cancer is when people believe that they have gotten the upper hand on their cancer and they slack off the protocol which had been successful for them, only to see cancer coming roaring back with vengeance. When you believe you've gotten the upper hand against the cancer, it's not the time to slack off, and neither is it time to pull back your efforts when you have been given a cancer-free diagnosis. Rather, this is the time to bear down and make sure that cancer and its root causes have been completely eliminated. You need to ensure that cancer will not return, or that it is still not lurking in your body waiting on the opportunity to have another battle, often with circulating tumor cells and circulating stem cells, which are the most difficult to eliminate. Let me just give you amazing tips you can do to ensure that your alternative treatment is successful by helping yourself and by helping me. These are very important tips. The very best natural alternative cancer protocols are ones which address every area of your body, which may contribute to cancer as well as prevent it from being a cure. Here are 8 tips for creating successful cancer treatment protocol. Let me just tell you that. Let me just give you these 8 amazing tips for all my cancer patients. 1. Eliminate and avoid toxins, which are far and away the number one cause of cancer. 2. Ensure you have a healthy liver. Include open and free flowing bile ducts to help eliminate toxins. 3. Make sure that you have optimal nutrition and address any nutritional deficiencies. 4. Include very healthy diet which incorporates the best cancer fighting foods. 5. Require exposure to plenty of sunshine and vitamin D. 6. Help you manage stress and address unresolved emotional issues that you're going through in life. 7. Call for regular physical activities. Exercise. Take up running. Take up yoga. Take up Tai Chi. Take up simple martial arts, swimming, simple walking daily. 8. Include key anti-cancer supplements which this clinic provides. In concluding this video, the 5 reasons why people fail with our treatment: because they're not following our treatment at all, because they have been ill-conceived, a preconceived notion of a treatment which they don't seem to understand is a non-starter for them. So alternative treatment is the most holistic, balanced approach with plant-based, no chemicals, no synthetic treatment whatsoever. It's all plant and herb-based. And I hope you found this video to be helpful into understanding what cancer really is. This is an invading army, invading your body. It's going to take time. Don't expect miracles, but there is a hope. There's a hope, end of the tunnel. There's light end of the tunnel. You must be ready to live with this, to support yourself and support our efforts into curing you. Participate with us. Listen to what we have to offer to you and go for it. Don't look back, and always be positive. Always look on the positive side of life, because anxiety and stress is a common denominator for cancer. The reason I made the supplementary treatment program, the 5 reasons why the alternative treatment fails, is because the very reason, or rather contrary to it, does succeed. And there's been remarkable results in our treatment program. You've seen my program on the Master Part 1 and Part 2 now. You gather this a very comprehensive, astute approach that we have into treating my cancer patients. In concluding this message, I hope you found this video to be helpful in understanding your illness, and I hope you subscribe to my channel. Do leave your comments, as your comments mean a lot to us. And do look after yourself, and may God be with you, and do have a nice day.